Hello, everyone, and welcome to this audio podcast as part of the Loop or Remit series. This audio podcast is part of a Labostix Bloca. This audio podcast is part of a Labostix View. This audio podcast is part of a Storm and Labostix production. In this audio podcast, we'll have some conclusions in around the work in around this works. So, making all forms of digital communication as easy to use by as many people as many as possible was the remit of W3C's Web Accessibility Initiative. NHS England's Accessible Information Standard had gone beyond. All providers of publicly funded health services are obliged to support patients, carers, and patients with disability, impairments or sensory loss directly or indirectly, affecting communications. Channels on Channels of communication such as email and text and methods for remote consultations remote consultations are also have been covered by W3C's Web Accessibility Initiative. So too on the provision of at the same time the provision of documents in alternative formats such as large print or easy read, and face-to-face support at consultations like sign language or advocates. The standard is backed by law underpinning the widely accepted moral and business cases, and though novel at the time, and still to become and was still to be embedded in routine practices, the standard would inevitably add support to the growing evidence. Uh, and in around this at the same time, uh, uh, assisted technology for example should be acknowledged and understood by employers of individuals with disabilities, allowing healthier work environments. More awareness is required, and benefits from health support are often go well beyond the system itself, based on implications. Studies, investigations have shown employment is needed to not only provide living, but to sustain health and well-being. And work fulfills work evidence informs work fulfills a number of basic requirements or needs for individuals, such as collective purpose, contact, status, and activity. A person with a disability or long-standing condition or long-term condition can often be isolated, and work is one way to reduce isolation. Isolation. At the same time, a little bit around KDOS, or the Kidney Disease Renal Support Group, KDOS for Kids Group, already and has now gone beyond the use of social media as social media in context of a basis in around its initial sort of part of its initial initiative. In the literature, peer counseling is another way of fighting discrimination and ignorance, and specifically this involves the linking of recent persons of persons with disabilities and long-standing conditions or long-term conditions to individuals who have had a disability or a long-standing condition or long-standing condition or long-term condition for a longer duration. The relationship or the interrelationship would help to would aim to help with understanding and sharing experiences, helping towards autonomy and self-determination. In addition, peer counseling also aids in providing a basis of information, advice, and signposting, referral, and assistance. And peer counseling is important. Is important. It promotes support and mentoring between those who between those who may suffer. So KDAS has um, has alongside its initiative as a social media platform for parents and guardians, young people, siblings, etc., those who are in suffering with kidney disease, but also where a lot of the young people have morbidities, other morbidities. The KDAS team have co-developed or developed a sort of an educational hub where young people, etc., can meet sort of physically meet physically, and where there is sort of where there's opportunities for those for people and those to share to further share sort of experiences, and at the same time, as part of this sort of the conclusions around here, uh, to also inform that a central concern to both national and international governments is trying to better understand how to effectively support patients with disability and long-term conditions or long-standing conditions like CKD, who have increasingly complex who can have increasingly complex healthcare needs, and this has been driven by shifts in public policy in public policy. One sort of recent example, or one of the recent examples, at least when this original works was developed, was perhaps was an example of perhaps indirect yet authoritative sort of discrimination against people with disabilities or disabilities specifically, specifically was in a recording made during a fringe meeting at a parliamentary conference in August 2014. And the minister at the time, the minister for welfare reform at the time, had informed that some disabled people could be paid £2 an hour, rather than a full rate of 650 at that time, around 2014 or thereabouts, was the minimum salary. And in its direct quotation, it was informed, the minister for welfare reform at the time informed some disabled people could be paid £2 an hour, rather than the full rate of £6.50, if they wanted to work. And The statement highlights obvious concern, and this also informs views that have had to become more informed, and this also informs the views that that have to become more informed are not always of those of other chronic or of those chronically ill or those with long-standing condition or long-term condition, disabled or carers or relatives, but unfortunately, can be of academics, health researchers, employers and service providers who lack an awareness, lack awareness. So one of the questions here at the same time, what could be done differently? And one of the main messages here is that policy makers should be making more headway to support people with long-standing conditions or long-term conditions and disabilities, and to preclude discrimination and ignorance at all levels. In addition, social media usage has grown exponentially with sites such as Twitter, Facebook, Instagram, and others now representing more than 20% of the time online, and more, and not surprisingly, people with disabilities and long-standing conditions or long-term conditions seek peer-to-peer support through social media, which offers advantage over standard forms of access and owing to immediacy, and offers an opportunity for education, and the use of information communication technology, and highlighting sort of the challenges of living with a disability or long-standing condition or long-term condition through social through social media is important for most patients, because many want to be involved to prompt issues like ignorance and discrimination, which can be overwhelming. At the same time, all information communication technology (ICT) and social media interfaces are potentially helpful, and should be prompted to preclude discrimination and or ignorance. However, acquisition of knowledge alone is unlikely to be sufficient to motivate behavior change. Uh, at the same time, ongoing challenges can occur, where people can feel pilloried, and so awareness also needs to come from sort of a bottom-up approach. This would also constitute sort of patient and public involvement, or PPI, for prospective initiatives. Social media platforms like Facebook, including Twitter and Blogspot, etc., are also helpful. However, overall there needs to be a sort of a change, and this needs to this needs to this needs this should this should be this should be this would help ensure to ensure a sort of more sort of linearity and across sort of services more positively. And if policymakers are potentially discriminating at top-down level, then what chances do people have at bottom-up approach from a bottom-up approach? And so there is thus a need for a change, for behavior change, behavior change or behavior changes in around this. Um, so that draws this audio podcast to a close. This audio podcast has been part of as part of the Loop Remit series. This audio podcast as part of the Labostix Bloca. This audio podcast as part of the Labostix View. This audio podcast as part of the Storm Labostix production.